Hi, my name is Isabella Mutumbe. In today's lesson, we're going to pick a topic in IRH, which is puerperal sepsis. So what is puerperal sepsis? Puerperal sepsis, this is an infection of the birth canal that occurs 6 weeks after delivery or abortion, and it is characterized by a temperature of 38 degrees and above. So the causative organisms of puerperal sepsis can be Streptococcus hemolyticus. This is usually a throat infection, but if it goes systemic, it can also go in other systems and cause an infection. We also have Escherichia coli, we have chlamydia, Streptococcus aureus, which causes abscesses, and many more. So the mode of transmission of puerperal sepsis comes in three, where we have exogenous, endogenous, and also autogenous. So the mode of transmission of puerperal sepsis can either be exogenous, endogenous, or autogenous. So exogenous infections, these come about due to unclean surfaces. Let's make a scenario where this woman is someone is conducting a delivery and they do not use aseptic techniques. There are some causative organisms like Clostridium tetani that are found on dirty surfaces and that can cause an infection. When we come and talk of endogenous causes or mode of transmission can be caused by normal flora. The normal flora that is normally found on that site can cause an infection if it ascends to another site. In a scenario where this person is conducting a vaginal examination and then that infection goes into the uterus, it can cause puerperal sepsis. Let's also talk about lacerations, where someone has delivered. If this woman is just from delivering and she has got some lacerations or tears, this can predispose her to having puerperal sepsis. When we talk of autogenous, this is a puerperal sepsis that comes about due to an infection that was already in this person's or this woman's body. Let's make a scenario where this woman already had an infection and then it has just spread to the other side. So these are the three modes of transmission of puerperal sepsis.
So the cause of infection of puerperal sepsis, this infection can be localized. It can be either on the perineum, the cervix, the vagina, or the uterus. If it is in the uterus, it can spread to the fallopian tubes, to the ovaries, and also to the peritoneum and cause peritonitis. This infection can also spread through the lymphatic system in the blood and become a systemic infection and cause septicemia. Some of the predisposing factors of puerperal sepsis are a large placentocyte. A large placentocyte gives room for growth of bacteria. Therefore, it can lead this woman to have an infection after a delivery. Poor hygiene, or maybe the environment of which this woman was delivering from was unclean. Therefore, this woman acquires an infection. Also, we can talk about infections that the woman, pre-existing infections like STIs, this can make this woman prone to having puerperal sepsis. Some of the clinical manifestations this woman can present with are fever, and this fever can be above 38 degrees. There can be lower abdominal pain due to inflammation. There will be abnormal discharge, foul-smelling discharge due to infection. There can also be purine discharge due to infection, general body malaise, hypotension that can come about due to infection, and also tachycardia due to hypotension. Okay, so some of the investigations that we can do to find out which specific causative organism is causing this infection are history taking, physical examination, urinalysis, abdominal scan, midstream for microscopy, and etc. The treatment that this woman is supposed to receive are antibiotics. We can also give analgesics for the pain. We can give fluids to flush out the toxins. This is all about puerperal sepsis. Thank you so much for your attention. Bye. See you next time.